how do you see evolving encryption, undecrypted reading of data using AI tools, helping healthcare organizations to make their data more protected?
And we can get it to a point, when we're sharing it with like a research institute or something like that, that they can use the data in a de-identified method in an encrypted state, and
I think important for solution providers, not only healthcare service providers, but also technology solutions providers, to work towards this area in a structured way and try to build solutions around encryption, intelligent encryption, and the ability to undecrypt but still be able to read data through AI agents and with very limited human interaction. So I think that's really important. But another thing we touched upon earlier briefly was related to telemedicine. We spoke about telemedicine, and we saw that there are a lot of telemedicine solutions available today in the industry, healthcare industry, IoT devices, real-time monitoring, care at home, remote care at home, those kind of things. But obviously with that, there are emerging new vulnerabilities or threats. And how can healthcare organizations use AI, ML, and technological solutions to improve the protection of such threats?
Yeah, I mean, telemedicine, we generally think of as having this video chat with your doctor like we're having now and things, but it's so much more than that now. It's, telemetry and all the models that can come from collecting patient data, whether that's through your Apple Watch reporting data back to your cardiac surgeon after a surgery, an implantable device like a pacemaker that reports back to those vendors. It could be a knee brace that your doctor monitors to see how much extension and flexion you're putting in your knee. Those type of devices we're seeing on the forefront, but I think, even going past that, we'll see that at-home testing ability as well, right? Instead of going to a physical therapy, could you do it at home? Could you send a patient a kit to where they can take all these measurements themselves and work with the providers rather than taking them in? And when we remove those barriers of time constraints and access and everything, then the patient compliance goes up significantly. And we've seen that in the industry, but it's very difficult. It's very difficult for a provider to work with the problems of how do I communicate with a patient at home. Even just trying to get a voice chat like this. I mean, we spent 20 minutes trying to make sure that this all works out, and that we get a good quality talk and we can understand each other and hear each other, and all that takes time. And patient staff right now are already overwhelmed. If you think of the medical assistants, the administrative assistants, the doctors, the nurse practitioners, the whole line of people, they're working as hard as they can all day long to try to get patients through here to see the doctors, because there's just more demand than the industry can meet. But at the same time, the wages are going up, but provider compensation is going down, and it creates more and more pressure to provide these services at a lower cost. And I think one of the things that AI can definitely help with is taking those areas that are not high job satisfaction areas and removing that from an employee's workload, doing it in a very cost-effective structure. So, we talked about telemedicine. If we look at the telemedicine journey and we take that 20 minutes that it takes to really get it set up and get the at-home stuff working, those instruction sets, those answering the questions, getting your camera set up, getting all these things working, all that is ripe for an AI bot to really go in and help those patients and do that. And it's stuff that's not being done today in the clinic. So it's not like we're, taking away jobs. We're moving people out of the equation. We're adding additional functionality. And we're doing it at at a similar cost of what we're doing now. Obviously, technology is always going to have a cost, but the idea is that this should cost less than a human to do those things. And they're not a satisfying part of the job. If I'm a medical assistant, I didn't get in medicine to tell a patient how to connect their webcam. I got in medicine to help relieve the pain of those patients and help make them feel better on a daily basis. So we want to empower those people to be able to do that job and take away those mundane tasks, take away those hard to do because they're repetitive tasks, and push those over to something that doesn't get tired, like an AI bot.
And I'm kind of able to relate what you're saying right now to our engagement with FOI. And I think in every conversation you bring out the same point, that my providers are there to make the life of the patients easier, and not by making the providers' life difficult, right? So the solutions that we develop for you have to be user friendly in a way that your providers find it really, really effective and easy to use. So I think I want to narrate. I'm kind of back narrating it so that I would like the entire forum to connect to that, because that's the emergence of the thought process, and that's how I think we kind of get the requirements from you. But I think over a period of time, we have also started connecting the dots and have been able to correlate most of our solutions in that aspect.
Yeah, one of the key areas that Y's been able to do is really understand our processes, and and we did invest time to make sure that they did, so that we can use them to understand what's happening in the industry, and they can bring forward proposals like, hey, I see that we're developing some place for a person to copy and paste this. How about we go ahead and robotic process automate this to where they don't have to do that anymore, and we're really excited for the areas that your team has brought to us to say, these are key areas that we think we can implement to reduce the workload on your staff, because technically, I mean, you just can't bring enough staff. Like, we always have open positions in benefits, authorization, medical assistance, all these jobs, there's just not enough people to solve the problem. So being able to do that, with AI, but even with robotic process automations that exist today, have been, a huge benefits. And if you call our phone lines, you'll get a bot that can help you do certain tasks, but it doesn't do everything for you. We're trying to replace the scheduler. We're trying to take the things like confirming your appointment. Nobody wants to sit on the phone and confirm appointments with patients all day. And the patient doesn't necessarily need to talk to a human to do that. So we try to find those key aspects where a bot or an AI entity can help in those areas, and that's where we try to leverage that process more so. And as AI gets better and can handle more work and can handle more of the edge cases of that work, then we'll continue to introduce them more and allow those employees to handle the more employee-centric tasks of being able to really collaborate with patients and improve that patient journey.
Yeah, and I'm capturing all that, and I think my mind is already working on what next can I do for FOI, right? So thanks for that. However, I think one important thing is all said and done, whatever automation you bring in AI, you bring in ML, you bring a tighter security circle around you, but finally everything has got to be executed by people, humans, right? And we have interacted about this earlier, and when we also engaged with FOI, you were particularly very, very keen and wanted us to ensure that we train our team on HIPAA guidelines as well as cybersecurity measures. So how important do you think the training related to cybersecurity regulations is important for the team that is delivering these healthcare services to patients? And with AI and ML, do you see anything changing or making the life of these team members easier in terms of training and knowledge related to cybersecurity?
Yeah, this is an area that obviously touches close to home for me. Cybersecurity background. This is and a HIPAA security officer. This is where I live on a daily basis. So one of the things that I really don't like about what we do today is we do a lot of like training videos, right? We have an experience where you sit down and you watch an hour worth of compliance and training videos once a year or something along those lines. And yes, we have, training events and things like that, but it's not an engaging learning circumstance. It's a repetitive memory circumstance. So instead of just pushing the Y team through, here's compliance training, go watch these videos. Instead we did, I sat on videos and walked them through, here's how we use this product, here's where the security portion is. But obviously doing that for every employee, I can't do, right? I mean, you can do it a couple times a year maybe, but what AI can do is do that for every employee and do it well and answer their questions and engage them on the topics and test their knowledge and make sure that they're doing things correct. If you think just as simple as a phishing test, one of the the main areas that we still get hacked on a regular basis from healthcare is credential theft. And the main area that you can do that is with a phishing email. AI being able to understand the intent of that email is a huge win. There's a number of products out there that are really trying to push that forefront now, but being able to protect them. But on the other side, being able to train them, I think, is where we're going to see one of the biggest benefits from AI. Being able to have that bot that when a new employee comes in, he can ask that question, hey, can you look at this email for me? Hey, can you check this out, and being able to respond in real time. Obviously, from a staffing perspective, you just can't put enough staff to do stuff like that. You can't answer all the questions from your employees, and when you can, it's got to go into a queue, and there's a lag, and it's not a great experience. But I think the promise of what AI has is that real-time interaction and being able to train, reinforce, and provide an escalation resource for those employees, so that they can continue to improve on their security skills and have that backing to, when they get in trouble, somewhere to get out.
I think that naturally kind of moves me into the next question. You naturally kind of led me into it, and my next question was going to be about incident response, right? And obviously, when there is data, there are vulnerabilities. When there are threats, there may be and will be incidents. So, from a healthcare perspective, how do you see, or what's your advice for healthcare organizations and their technology partners for better management of incident response?
Yeah.
And what strategies the healthcare organizations as well as the technical solutions provider must adapt?
Yeah, I think in healthcare we get a little complacent because of how loosely the HIPAA regulations are defined in the cybersecurity realm. I'd love to see the standards raised to ensure that providers are taking all necessary steps to do that, to protect that patient data and things. We're probably a ways away from that, but I think for every provider, lowering the bar to that entry is a big method forward done on solving that problem. So, we talked a little bit about SIM and SOAR and being able to collect those data logs into a centralized aspect and being able to react on those data logs quickly and effectively. And the next natural evolution for those SOAR products is going to be, they're going to throw an I in that acronym somewhere so that they can have AI in there, and make it more intelligent. And, right now the SOAR is based on either heuristic or a signature type detection in order to make a response. But shifting that to intent is going to be the next biggest thing. And from that side of the journey, I think the other part is to ensure that you aggregate your data as much as possible. So, Fabric is a great example of, Microsoft trying to pull all this technology together. And there's other vendors that are doing it as well, but all the data lakes and the data storage, products are trying to aggregate data into an area that you can have that information, right? If I'm trying to understand intent, then I have to have the information that can do that. And for AI to be able to make that inference, then it has to be able to look into your schedule and see, does that patient have an appointment in the next 30 days? Did that patient make a phone call to your practice? Have you faxed to this location before? If it doesn't have that data, there's no way it can make that inference. So I think what practices can do today is to aggregate their information in a way that it can be used by these machine learning algorithms, put in pieces of the solution like SIMs and SOARs to where they can start responding on those things, and be prepared for when AI has the ability to look into that data, find the intent, and then provide that bigger solution. And then I think, probably just worth adding on to that is that you bring a number of technologies together to make a solution. You want to use Lego blocks. You want to separate out what is important. And I think from an industry, what we're going to see is the removal of these large monolithic applications. We think of like an EMR today that was designed probably back in 1980 from the original database design, and how we structure the data and how we interact with things. We're seeing those EMR providers move from I am your one source of truth to I am a centralized resource that you can plug into to work with other vendors. And Athena is the application that we use for our electronic medical record, and they have a marketplace called More Disruption Please. And it's really a source where they've exposed the APIs to connect into the system in a way that anybody can program against it. It's really helped us, working with the Y team here to be able to tie into that. We've made, an entire authorization and benefits management system, a surgical billing system, and things like that, in order to leverage the data set and the great parts about what Athena is, but augment them with our practice specific methodologies and ways that we can make our physicians' lives easier, and where they can focus on the patient care. So all those things kind of put together, it's a sprawling topic for sure, but I think you have to centralize the information. I think you have to put the monitoring on top of that centralized information so that we can ensure that we get it all into a solution for security.
Certainly. And you spoke about Athena and that being your EMR and creating an opportunity for us to work on it. And I think that was a big eye opener for us in terms of what can be done with the right integrations. And I think we've learned a lot, and we've been able to learn and implement a lot of solutions. And thanks for that opportunity. The one thing I think you've kind of touched upon in detail about a lot of things, but the last question, and then there is another one after that, which is going to be a more selfish question. But the last question from a knowledge perspective is that in the near future, let's say 3 to 5 years, how do you see the industry moving towards adapting AI and ML? What's your view on that?
Yeah, I think the first part is that robotic process automation. I think that's the first stage of the journey. Taking the lowest lying fruit to say, this is a task that gets repeated 100 times every day. Let's make it a robotic process that can do that. And then taking that step of the journey, the next step would be, how do we start understanding where that information is going to come in and pulling it into it. And then from there, just continuing to build upon that solution to where we start bringing in those AI aspects. But I think the journey doesn't have to wait until the AI and MLs of the world catch up with your specific use case. I think what you can do is start that journey today with, the robotic process automation, identify those low-hanging fruits, and then start building upon those to grab, that higher and higher fruit off that tree. I think when we do that, we'll grow as an industry together. I think if you try to make that leap to AI without, putting in place these low-lying areas, then you're going to struggle the whole way. You'll typically, start with this huge bill, and you'll have to go through and try to understand the value to your company in a way that you can't really it's not tangential. So I think taking those small steps is the biggest thing, and working with a custom solution provider is a great way to do that. Y does a great job of understanding the business processes and bringing in a small incremental improvement in areas that we can see immediate return on that value, instead of saying it's $3 million to go implement this major AI project that we're not 100% sure is going to work. We can say, let's invest a small amount of money and get this improvement, see that ROI immediately, and then build upon that technology. I think that's how the industry is going to develop into AI in all of these different solutions.
For the viewers on this forum, it's going to be really, really insightful in terms of understanding how the industry is going to move and what they should be prepared for, right? So thanks for that. And as I said, the last question is going to be a selfish one, and I'm going to be briefly talking about our association. That means Y Technology and Florida Orthopedic Institute. And you have been the primary anchor for bringing us into the mainstay for providing technical solutions to a healthcare provider. And I think you have really coached, mentored us and our team, and we are now very confident in saying that we have acquired we always had the technological expertise, but I think we have really built our domain expertise riding on what we have worked with FOI on. I would like to hear from you what you think of the association. and what do you have to say about Y Technologies?
Yeah, I mean, we really fell into this agreement. We found a technology that we really liked with ASP dot or ASP Bootstrap ASP or whatever, ASP.NET Bootstrap, and we saw the value of that program, and we looked for providers that could do it. And we talked to a few of them, Y being one of them. And when we talked with Y, we found that there was a difference in the way that they talked about the project. It wasn't give me a specific set of deliverables and I will code those specific sets. It was how do we make this journey? Let's take it in phases. Let's work through the problems. But it wasn't we've got to scope it all out immediately, because we didn't know. We're a physician practice. We're not a code development, software development company. So we don't know exactly what we need. We know what we're trying to achieve. And I think that's the value that we saw with Y more than anything, is they were willing to take that journey with us rather than say, go ahead and do that journey, and when you get that in deliverable, let's do it. Or here's a whole separate team. They'll scope the whole project, and then they'll ship it over to developers to work. And we saw that, in a number of solutions. But what we saw with Y was that team is going to be with you from start to finish. We're going to scope the solution with you. We're going to understand it together. We're going to work with you to have training classes and bring them in to understand your business processes. We're going to work directly with business leadership. And every step of the journey, then we get a better relationship, a better understanding, and can pull it all together into, a really significant improvement product for us. And and it's just the first step of the journey for us is the great part. We're seeing amazing improvements on our billing, benefits, authorizations, and the applications that we built with you. But the real thing that it does is digitize that information that was largely taken in, paper processes or scratch pads or Excel spreadsheets. And now it's in a centralized location where we can start to put that robotic process automation. We can start to put that AI on top of it, that machine learning on top of that information. We can build, reports that extend outside of the application and pull into other applications to grab all that information. And all these areas, we needed that groundwork, but we didn't know exactly what we needed. So thanks to you and your team for really, just taking the journey with us rather than having us deliver a point in time solution with you.
Yeah. No, and at the same time, we are humbled and honored to have have a partner like you, somebody who has coached and mentored us through this journey and helped us to build not just our technical capabilities, but also the domain solution capabilities. I think that's something that we have really, really gained over the last 3 years having worked with you. And I really sincerely wish to thank you for that and creating that opportunity for us. That brings us to the end of this podcast, Chris. I mean, we had a bunch of questions. I think I had a bunch of questions. I believe all are answered. And I think you have really given insightful, made an insightful conversation. I'm sure that there are a lot of takeaways, not only for us, but also many others like us. The Y Involve network is not about Y Technologies. It is about you. It is about the message that you want to give out to the world, and also for the forum members to look through and learn and create opportunities. And thank you very much for enriching this community. Chris, thank you very much.
Yeah, really my pleasure. It's great working with you guys on all the fronts, but opportunities like this where we can get out to the industry and try to advance the technology of the industries and how they use it, and most importantly, advance that securely, I think is always a great cause. So I really, appreciate this podcast series you guys are going through, and the time and effort that it takes to put these together and what it does for the community. So always happy to be a part of it. Always happy to, field questions and work with people on collaborative ideas and things. So feel free to hit me up on LinkedIn, hit me up on Facebook and these technologies, and I'd be more than happy to have the discussions with anybody.
So gear up for the next session, Chris, and we'll certainly catch you at.
Always a pleasure. Thank you, guys.
Thank you very much. Thank you. Thanks a lot.